Hi, Dr. Drew McPhail here, McPhail Chiropractic Pain Relief Clinic here in Somerville. I want to thank you for coming to my website. Today I'm going to talk to you about one of the common causes of knee pain, one of the underlying conditions that a lot of people aren't familiar with or don't know that they have that's causing their problems. Now, some people who present with knee pain, they'll say they've been diagnosed with bone-on-bone knee pain or osteoarthritis of the knee or just any sort of knee pain. A lot of times the cause of this could be from an initial injury, and say they stepped in a pothole, their dog ran into them, they had an athletic injury. Okay, and these are some of those more traumatic causes of knee pain. But for those patients that haven't had the trauma, that just over time their knees begin to deteriorate, and there's an underlying cause that results in those degenerative conditions. Now, what we're going to talk about is what's called the neurokinetic chain of the lower extremity. What this means is the way that your legs work. Okay? Now, the way that it works, we have T12, L1, L2, L3, L4, L5, S1, and S2. Okay, what this is, these numbers relate to what's called the lumbosacral plexus. Okay? The nerves that exit your back from here all the way down here that supply energy down through your thighs, knees, feet, and ankles. Now, the reason this is important, a lot of these patients who experience knee pain, they also have a history of back pain. And what we'll find is when we're doing our evaluation, we do have some nerve deficit and we do have some other problems that are affecting the function of their lower extremities. And one of the most common things we'll find is these patients have a history of sciatica. All right. Now, the reason this is important, what we find, or the way that it works, is branching off of L2, L3, and L4. Okay, we have a nerve called the femoral nerve. Okay, and what this controls the muscles of the thigh. Okay, it's what allows you to kick your leg out. Okay, whenever you're walking. Now, branching off of L4, L5, S1, and S2, we have what's called the sciatic nerve. Okay, this is very common. People diagnose themselves with sciatica all the time. Now, what sciatica is a compressive phenomenon that occurs in the low back where the discs degenerate, and then they start to put pressure on those nerves, which results in that pain. Now, the reason that this affects our lower extremities and causes these degenerative knee problems is the sciatic nerve, when it gets to the knee, it turns into what's called the tibial nerve. All right. Now, what the tibial nerve does is it actually controls this little muscle that's called the popliteus. Okay, and what the popliteus is the key that unlocks the knee. It's on the back of the knee there. A lot of times patients with knee pain will have a lot of pain in that area as well. But basically, every time you walk, it has a contract and release, contract and release. Now, what happens is what we find when we do our evaluations is some of these patients are going to have L4 or L5, L2 nerve distribution problems. We determine that through our neurological evaluation. Well, after I take some x-rays on them, we find that they have degeneration of the L4 disc. Okay, they have degenerative disc disease, or they have bulging discs or spinal stenosis in that area. Now, the reason that's important is the L4 disc has distribution to the femoral nerve and the sciatic nerve, so it affects both areas. So what happens is when the patients are walking, okay, instead of the knee gliding smoothly, what happens is it becomes sloppy. So every time you take a step, the knee begins to deteriorate and the meniscus begin to wear out. It also makes you more susceptible to those types of injuries. So if you've been diagnosed with knee pain, all right, you need to get the whole picture and find out what's going on, because if you do have a neurokinetic chain problem and you go ahead and you have a knee replacement or you have the surgery, well, guess what's going to happen? All right, it's not going to work out really well for you because you haven't addressed the entire cause of the condition. So if you're suffering from knee pain, please give me a call. Come in for an evaluation. Let's see what's going on. My number is 843-873-2225, or you go to McPhailClinic.com and request an appointment there. I want to thank you for tuning in, and here's to your health.